Hey everyone from the COVID quarantine room. This is day 4. I just got some good news. I found out that because of a ruling by ACA, and ACA is how do I say this? It's basically the organization that makes a lot of the rulings as far as when people need to be quarantined and things like that, and they work closely with the CDC and that sort of thing. But anyway, there is the symptom-based strategy that employers can use now for healthcare workers, and it's called the symptom-based strategy. And basically, you're excluded for work for 3 days, 72 hours have passed since recovery, which they define as a resolution of fever without the use of fever-reducing medications and improvement in respiratory symptoms. Now, this is for individuals with suspected or confirmed COVID-19, basically the nasal or throat swab, not the blood test. All right. And at least 10 days have passed since symptoms first appeared. Now, if you're asymptomatic, you still fall under this, which I do because I was confirmed positive. And by the way, as I told everybody before, I went and got tested a couple of days ago at the Mahaffey Theater, where they're doing that here in the city, St. Petersburg, and those came back this morning. Those are also positive. So clearly, I have it, but I'm very fortunate as I don't have any symptoms. So that's fun. That's wonderful. In fact, I just had two coworkers. One who was on an event right now. She went in less than 24 hours. She was perfectly fine the day before and then passed out the following day. And she's on a vent. She's not doing well. I have another coworker who is now with fever, and she's got some lethargy and things like that, but her and her husband both are doing okay beyond that, and they're hoping it stays that way. But anyway, so this brings up an important point, though. One of the things I wanted to talk about real quick was viral shedding. And basically, what viral shedding is, you continue even after the onset of symptoms or resolution of symptoms also to shed portions of the virus. Now, what they have found for COVID-19 is that you can be infectious for up to 2 weeks without even realize you're being infectious, which is the reason we wear the mask. However, they've been finding in various studies and the science from different countries, from Germany to China to Singapore to the United States, many other countries, is all matching up that on average, for a person with mild to no symptoms, which would be me, you can shed the virus for up to like 30 days. Now, that virus that you're shedding is not infectious. They're not finding that past 2 weeks. They're finding that they're only checking for the RNA, which is a portion of the virus, meaning there's something there, but it's not the virus itself. It's not infectious. You're not going to infect anybody. So that's all good, and providing you don't have any symptoms. Now, what they did find beyond the 30 days is people with severe symptoms or who are immune compromised, things like that. They may have that viral shedding much longer, and it may be infectious. But if you've got severe symptoms, they're testing you to see if you're infectious anyway before they release you out of the hospital. So that's something good. Anyway, that's all for today. If there's anything that I've said, by the way, that my friends who are in infectious disease that think needs to be corrected, please let me know, or update me if I'm missing something. Everybody have a good day and stay safe. Wear a mask, wash your hands, use the hand gel.